Well, Zimbabwe has extended its level 4 lockdown for a further 2 weeks as COVID-19 cases climb there. The restrictions are now expected to end on the 15th of February. It is expected that this will further cripple Zimbabwe's economy, which has been struggling for years now. The crisis has also forced the Zimbabwean government to confront its failing healthcare system. The country has around 30,000 infections and nearly 1,200 known COVID-19 related deaths. Dr Norman Matara is with the Zimbabwe Association of Doctors for Human Rights, joining us now for more on the COVID-19 situation in Zimbabwe. Doctor, a very good evening to you. Grateful for your time. Do you believe that the extension of the lockdown to the 15th of February will help deal with the COVID-19 situation in Zimbabwe?
Right, thank you very much for this opportunity. Of course, we had a lockdown that was declared around the beginning of January, and ever since the lockdown was introduced, we've seen a decrease in cases. Actually, for the past month, we have seen that cases have decreased by almost less than a third of the cases have gone down. But we think that the lockdown is not as fully effective because of several challenges that we are facing. We see that people continue to go out of their homes into the streets. We see that our economy is mainly informally based, and so you see that many people are going out to start selling their goods. So the lockdown is not being fully effective as it is supposed to be, mainly because of the informal sector that we have in the country.
And on that issue, what is being done for the millions of Zimbabweans who rely on the informal sector to make sure that those who do manage to stay indoors and abide by the restrictions are able to still be able to put food on the table?
So what we have seen is that people have not been abiding to the lockdown regulations, mainly because there's not been any social safety net for the vulnerable. Those people who are in the informal sectors, those small to medium enterprise businesses, they've not been cushioned by the government. So you see that they cannot abide to the lockdown regulations, and that's why many people are breaching the lockdown regulations and thus rendering the lockdown not as effective as it is supposed to be.
And I was reading earlier the finance secretary saying that about $100 million has now been found. This money has been put aside for the procurement of COVID-19 vaccines. How is the health system faring in treating COVID-19 patients while Zimbabwe waits for the arrival of vaccines, whenever that will be?
Yeah, so as a country, our health system has been deteriorating over the past few years. When COVID-19 came, we were actually under a very difficult time with doctors, nurses on strike, and a health system that was failing to cope. So COVID-19 actually made it worse. So we have a health system that is failing to cope with, especially with the increase in COVID-19 cases at the moment, with the second wave coming in at the moment. So you see that we have a limited capacity to deal with cases, especially in terms of high dependence unit and intensive care unit. We have limited supply of beds in the public sector, and many people have to rely with the private sector. And people cannot afford, the majority of citizens cannot afford to get admission in the private sector. So it's a very difficult situation for many people, and we hope that the government have a plan for rollout of vaccines. At the moment, they've just been promising us that they have a plan to make sure that we get the vaccines, but we do not have any concrete evidence in terms of how much has been budgeted for vaccines and how much are they planning to procure for citizens.
And what about the safety of healthcare workers? I know that issue ended up before a court in Zimbabwe sometime last year, where the likes of yourselves had raised issues about inadequate PPE or PPE that just wasn't up to standard. Is that still the case today?
Yeah, so the provision of PPE have been intermittent. We actually took the government to court, as you rightfully said, and the government promised us that they will provide PPE for health workers. But we have seen that ever since that court case, the provision of PPE has not been constant. It has been intermittent. You just have a few months where they provide PPE, and then you also have some months where people do not have adequate PPE. Just a few weeks ago, nurses at one of the major hospitals were actually on strike protesting over the lack of PPE. So we see that health workers continue to be exposed to the virus. Over 1,600 healthcare workers have actually been infected with the virus, mainly because of inadequate PPE in public hospitals. So it still remains a challenge, and we continue to urge the government to make sure that our frontline workers continue to be provided with adequate PPE.
Final question, Doctor. 32,000 plus known infections of the coronavirus in Zimbabwe. Over 1,000 people are now known to have died in COVID-related deaths. Are you satisfied with the quality of the data? Is there enough testing going on in Zimbabwe currently? All right, I think we've lost Dr. Matara there. That was Dr. Norman Matara. He's with the Zimbabwe Association of Doctors for Human Rights, speaking to us about how the country is faring as it extends its lockdown until mid-February.